Hello, and thank you for viewing our presentation. My name is Adam Sokol, representing OptimizeRx, and today, in partnership with Allscripts, B. Braun, Endosoft, Philips, and Rhapsody, we will demonstrate how the interoperability of 6 independent and dynamic health technologies help to support Quan, a 40-year-old male patient who is diagnosed with colon cancer and treated by a multidisciplinary team of healthcare providers. During Quan's journey, his medical team seamlessly receives valuable clinical data to create a comprehensive care plan for the best overall outcome. Quan, who is on a high deductible insurance plan, visits his primary care physician for possible anemia. Let's take a look at where and how each technology supports Quan's personal journey.
Endosoft represents a primary care physician and gastroenterologist in this use case. Endovault is our EHR, and it is a meaningful use Stage 3 certified application. Quan is at his primary care physician's office reviewing lab results when he is informed of anemia after his complete blood count results are discussed. Endovault will have Quan's demographics and visit scheduled ahead of his visit. His physician opens Quan's patient chart, and on the first screen, it will show his clinical summary, including his allergies, health issues, and medications. His physician moves to the lab results screen and reviews his test results and will write a consult note with his recommendation. Endovault provides typical report templates that can be used to print the note. Quan is being referred for colonoscopy after his fecal occult test turns out positive. An order is created for colonoscopy using an order screen. Quan is provided with the information about his procedure, and after a history and physical, he is scheduled for the procedure and provided a copy of his office visit notes. An interface running in the background will create a continuity of care document and push it to registry. Endovault can also communicate with a messaging platform to pull messages and banners with some useful tips.
Messages displayed in the Endovault EHR are supplied by OptimizeRx via a proprietary API. According to the CDC, 1 in 3 adults over the age of 50 skip their colorectal cancer screening. While Quan is only 40, studies have found evidence that colorectal cancer risk may be cut by as much as 40% with colonoscopy screenings. In Quan's case, the messages within the EHR notify the physician of a patient support program that will help Quan prepare and successfully complete his colonoscopy. The patient support program is SMS text-based, offers the highest standards, is easy to use, and free to the patient. After completing registration, Quan will only receive daily text messages starting 5 days before his colonoscopy date. At that time, Quan will receive a medication reminder to make sure he picks up his colonoscopy prep at his local pharmacy and will be provided with any available patient savings offered. In the days leading up to his colonoscopy, Quan will receive additional patient resources, helpful tips, and words of encouragement. The day before the colonoscopy, he will receive simple instructions to take his prep dose appropriately and at the right time, all leading to a successful procedure. The colonoscopy will provide critical information to Quan's treatment team, and the clinical data will flow directly and seamlessly into Quan's patient chart.
Quan arrives for his colonoscopy, and his physician opens his patient chart in Endovault, and using the consent section of the application, Quan is able to digitally review and sign his procedural, HIPAA, and anesthesia consent forms along with his clinicians. After the pre-op workup is finished, the physicians perform the image capture, where quality metrics are captured automatically that can be further reported to the quality registry. His physician further finishes the procedural report, where all the appropriate measures are collected and coding is performed automatically. Endovault comes with a list of typical reports and procedure technique templates that the physician can use to save time while writing reports. Once the report is finalized, the application optimally generates the post-procedure, pathology requisition, discharge report, and the referring physician's report automatically, bringing in pertinent information from all of the sections of the application to reduce the amount of work and clicks for the physicians. Once the procedure report is signed off, the colonoscopy report and a continuity of care summary document is sent to the registry and oncologist's office.
Quan is diagnosed with colon cancer and referred to an oncologist who discusses a treatment plan and treatment support options with him and his wife. Quan is scheduled for surgery and chemotherapy. Automatic device integration ensures correct medication administration and documentation throughout his treatment. Quan works with his oncologist to remain engaged in his care.
Philips Intellis-based precision medicine enables comprehensive patient-centric cancer care. Endosoft sends Quan's clinical information to Philips, including lab reports, medications, allergies, vitals, comorbidities, social history, and the colonoscopy procedure report. The data is displayed on a rich dashboard to support the multidisciplinary tumor board participants while deciding on the next treatment plan. The treatment plan summary report is then sent back to the hospital Allscripts and the primary care provider office Endosoft.
Behind the scenes, Lineate's interoperability platform, Rhapsody, allows Quan's clinical information to seamlessly transfer among the clinical systems his care team utilizes. The platform centrally manages HL7, CCDA, XDS, X12, and other standards-based and custom connectivity across the ecosystem. This eliminates the reliance on point-to-point interfaces. Rhapsody can serve as a gateway between systems that utilize different communication protocols or messaging payloads. The Rhapsody IDE, or Integrated Development Environment, shown on my screen now, is where users can easily build and configure their interfaces. At the most basic level, an interface consists of a connection to an input system, logic to enrich, transform, normalize, or filter the data, and a connection to an outbound system. In Rhapsody, we set up connections to those input and output systems via what we call communication point, which is essentially connection to an external system over a specific protocol. Systems can easily communicate, whether they utilize TCP/IP, SOAP, or REST-based web services. Rhapsody also has the ability to read and write to a database, pick up files from an SFTP server or a local directory. We can generate emails and other protocols that are utilized in healthcare. This toolset can also be expanded. Once we have connections to the input system, we use tools in this filter toolbox to apply logic to the data to validate, transform, enhance, and normalize it as required by the external systems. We store all of the components that build an interface in this configuration workspace on the left-hand side here. In Quant's case, Rhapsody serves as an interoperability hub to send Quant's documents from both the Endosoft and Philips systems to Allscripts, and from Allscripts back to those systems at the time of discharge. We can see the workflow of one of those basic interfaces here, which utilizes the XDS ITI 41 Provide and Register document standard. Once the interfaces we have built are live and in production, we monitor the health of the connections and the overall engine in the Rhapsody Management Console. Here, I can confirm that the connections to the system connecting Quant's care are up and running, troubleshoot and resend messages that fail for any reason, set up alerting so I can be proactively alerted of any issues that might prevent data transmission. With Rhapsody's guaranteed message delivery, no transaction can be lost, and this ensures that Quant's care team has the right data in the right place at the right time.
Patient Quan Lee arrives at the hospital for his 7:30 colon resection. He is admitted, then brought into the pre-op area where the RN initiates the pre-op assessment. Notice that the assessment contains pre-populated information for Quan's pre-assessment testing 2 weeks ago. The RN saves the document. Allscripts received the CCDA treatment summary report from Philips via Rhapsody. The RN reviews for any clinical red flags. The RN navigates to the Orders tab. The previous RN prepared and inserted the main sodium chloride intravenous as per physician orders. An IV piggyback of vancomycin needs to be administered. The RN then navigates to the EMR and selects the knowledge-based barcode medication administration screen. Here she performs the 6 rites for drug administration, which include scan patient, scan med, verify the order details, then barcode scan the pump. Upon selection of the OK button, the order details is sent to the pump.
Bebron Space Infusomat pump can receive the secondary order while the current primary infusion is running. In this case, you'll notice that the primary infusion of normal saline is currently infusing at 150 milliliters per hour. A prompt will appear on the pump displaying an order received for secondary medication and the name of the drug. In this case, the drug is vancomycin. The nurse will then press the Stop button to accept the order, or there is an option to cancel. The nurse stops the primary infusion to accept the auto-programming infusion parameters. The nurse reviews each parameter by using the down arrow on the pump, and a check mark will appear next to each value. When all values are checked, the nurse presses OK on the pump and then Start. A reminder to check bag height and unclap secondary will appear. Press Start to begin secondary infusion. Bebron space pumps are equipped with dose error reduction software. Auto-programming does not eliminate the use of this software. Dose error reduction software provides safety limits like hard stops and self-limit warnings to medication rates and dose rates. Dose error reduction software acts as an added safety point while programming and continues to provide safe programming in the event of downtime or manual programming during an emergent event. The 5 rites of medication administration have become the 6 rites, to include the smart pump. All pump data is now being sent back to the EMR for near real-time documentation.
With the pump now running, the RN selects the Scan Complete and Medication Given button in KBMA. The EMR task is automatically completed. The RN then navigates to the flow sheet where the infusion details can be pulled in. The RN right-clicks to auto-enter the smart pump date range. Time columns are automatically created based on pump events, such as infusion start, rate change, primary infusion stopping, and the secondary infusion starting. Periodic data from the pump displays in the auto-generated time columns as defined by the facility. In this case, it's pulled every 10 minutes. The RN saves the infusion data. Quan is brought into the OR where the procedure is performed. The RN clicks on the Surgery Case Details tab, and this displays several subtabs that provide the scheduling details and preference card information. The RN clicks on the Intra-Op subtab where the participant and case times are documented. To document supply usage, the RN clicks on the Case Usage subtab. All of the items here came from the preference card, and the RN will modify quantities or add items as needed. Patient Quan arrives in the PACU where the RN continues infusion of the IV. The RN documents the initial PACU admission assessment on the PACU note. PACU relevant information from the pre-op and intra-op will be visible on the flow sheet and the PACU note. On the second tab of the PACU note is where the RN will document PACU discharge assessment details. The recurring 5 to 15-minute assessments will be recorded on the PACU flow sheet. Patient Quan recovers from anesthesia and is transferred to the inpatient floor. Quan completes his hospital stay and is subsequently discharged. The physician completes his discharge summary and the CCDA is sent automatically. By navigating to the Documents tab, you can review the CCDA that was automatically generated.
Quan comes back for a follow-up visit, and Endovault will have his visit scheduled. Interface receives a CCD document from his oncologist office before his follow-up visit. Quan reviews the biopsy results. discharge information, treatment plan, and summary with his primary care physician. His physician will open his patient chart to write a follow-up note and order further visits. With this interoperability using IHE profiles, we can make sure that Quan is given the best care available.
Once Quan is discharged from the hospital, he will meet with his oncology team to discuss his treatment plan moving forward. Built within the physician's EHR workflow, OptimizeRx will notify the physician of available patient assistance programs as well as hub enrollment forms to help the patient effectively access their medication and support the overall efficiency of the physician's office. This concludes our vignette demonstrating how 6 independent health technologies come together to connect multiple health specialists and provide a holistic approach to oncology care. If you have any questions for any of our partners featured, please reach out to asokol@optimizerx.com or any of the partners featured here today.